Joining us now on Face the State, the president and CEO of Hartford HealthCare, Jeff Flaks. Jeff, good to see you back here in the program.
Good morning, Dennis.
There's a belief out there that the coronavirus pandemic is sort of waning a little bit and people are letting their guard down as things continue to open up. What's your warning to them?
Well, we can't let our guard down. I think we have to look very carefully at the practices that have been put in place, the guidelines that are put in place. Dennis, when we look at Connecticut, we are faring very well. Across the country, there are 19 states who have seen slight increases recently, and Connecticut continues to see a decline. So again, I urge everybody to continue to follow the guidelines. We need to stay the course. We need to maintain our guard. And at the same time, look at our data every day in terms of what it's telling us.
I don't know if this is a myth or not, but I'm going to ask you because people believe that in the summertime when people are more outside and the weather is warmer, that you're less likely to get the virus. What do you think of that?
Well, people don't know with this virus. There's so much unknown, which is what makes it in many ways so scary. So we're learning constantly. People are working very closely with the Center for Disease Control as new information comes out. But certainly our leaders within Hartford HealthCare are really maintaining a very cautious approach during the summer.
What's the medical recommendation when someone goes out to a restaurant and they're 6 feet away from someone else and that person sneezes?
Well, I think, again, people are following the guidelines, maintaining proper distances, using proper hand hygiene, continuing to leverage the recommendations, I think, of our state. And I think Governor Lamont and his team have done the right things in terms of being very measured as we put these guidelines forward. And most importantly, Dennis, ensuring that we've got significant testing in place, which tells us real time the prevalence within our communities.
What are your doctors telling you about this maybe second surge we're fearing in the fall?
I think it's something we have to watch very carefully. Again, we can't get a false sense of confidence. There isn't a vaccine. So at the moment, we have to maintain, as we're seeing a natural decline during the summer, which is very encouraging. We have to maintain, great focus and attention and compliance as we move into the fall. So there is a real sensitivity about what could happen in the fall, and if it were to happen, ensuring that we are, prepared at the maximum level.
Take us inside Hartford HealthCare right now, because obviously we can't have cameras in there. What's going on in terms of the decline in hospitalizations? What are people seeing? Obviously fewer patients. Are they still wearing masks? Are more visitors being allowed?
So absolutely. First of all, people are wearing masks. We have all types of measures in place. It's really tremendous ingenuity, Dennis. We've put lots of precautions around where and how people congregate, how we ensure proper social distancing. But I'm so proud. We were the first health system, we announced it just over a week ago, to start to bring visitors back into our hospitals, which is so essential and important to do as part of how we give patient-centered care. So we are starting to see visitors back in the hospital. Many precautions are in place. We're seeing in our medical offices, we're paging people so that we're not using waiting rooms. There's so many different innovations that are moving forward now to ensure that we can do this as safely as possible.
Very soon, we're going to start to see some things lightening up, indoor dining, gyms will be opening. What kind of recommendations do you have for people as they start to enter these places again?
Again, I think using masks, using hand hygiene, following proper precautions indoors with safe distancing is all critical. But at a macro level, what we're doing from a state perspective, we've got tremendous data now from the testing we're doing in many different communities. And so we're able to measure real time an element of confidence and assurance around the level of safety we have within our communities. And that's really been critical to allow us now and to allow the state to put these new measures forward and to kind of gradually let these new services reintroduce themselves.
New York Governor Andrew Cuomo said this past week that he was kind of worried about a potential surge or spike in cases because of these protests and demonstrations where many people are going out and they're standing right next to people and they're not wearing masks. What is your thought on that, and what would your advice be for people who are holding these demonstrations here in Connecticut?
It's a risk. It's a definite risk. So we certainly urge people to wear masks, keep proper distancing, get tested. Certainly continue to get tested. Testing is free and accessible today, and it's really never been more available than it is in this moment. But we need to use good caution. We need to be careful, and I think, as Governor Cuomo suggested, it is a risk, and it's something we have to monitor very closely.
The million-dollar question, which you probably can't answer: when are we getting back to normal?
Well, Dennis, I keep saying I don't want us in healthcare to get back to normal. I want us to be better than normal. So in the community, I think we're going to see a return over the coming months as we continue to look at this decline to where hopefully the vast majority of the things we do, we can return to do safely and have people be in full circulation and do the things they enjoy and able to work and contribute. So I'm hopeful that's going to happen over the next few months, but we need to monitor it carefully and most importantly, look at what the information tells us real time so that we can make good decisions as time goes forward and protect the safety and health and welfare of our community.
And of course, it's not the old normal, it's the new normal. Jeff Flaks, the CEO and president of Hartford HealthCare, we thank you once again for joining us this Sunday and enjoy the rest of your day.
You too. Thanks so much, Dennis.
And we thank all of you for watching Face the State on this Sunday. CBS Sunday Morning with Jane Pauley is coming up next right here on Channel 3. We leave you with our moment of calm from our majestic Connecticut Supreme Court building, which is also the Connecticut State Library. Fabulous building right across the street from the Capitol. If you have a chance, check it out. Thanks for watching, everybody. Have a great Sunday.